Okay, welcome everybody. I'm gonna give it a couple of minutes to give everybody else a chance to jump on. And just for my friends and families and the LaCAN leaders, I'm going to ask y'all to turn on your videos at the beginning and introduce yourselves in order of your region. Okay, I'm going to stop sharing my screen. We're going to start the 2020 legislative debriefing. We're doing this as a webinar and open it up to public. What I'm going to, what we do every year, just so everybody knows, this is kind of the tail end of the legislative or the advocacy cycle for the year. We start off with collecting people's ideas that they deem important. This year we had 107 items that came, and this group, the LaCAN leaders and some families directors and the partners coordinator, get together and rank and debate those things and forward a list of priorities for the Louisiana Developmental Disabilities Council to consider on its forward-leaning agenda. Now, I'm Sean Fleming. I'm the interim executive director of the Developmental Disabilities Council. And then in October, the council determines, they look at that list and they decide whether to adopt some of those or all those or changes to it. And then they put some of those ideas forward. And we have basically fact sheets, and we try and educate policymakers and members to make sure everybody is familiar with the issues and has the information they need to advocate. And then the legislative session hits, and we there are other issues that other people bring forward that impact people with developmental disabilities. And so as those come forward, the council takes positions, and this group has been meeting weekly. Fortunately, I mean, this is some of the, as horrendous as COVID-19 has been to particularly our community, you know, one of the things it has done is it's kind of brought us closer together in a sense by allowing us to have these weekly, we've been speaking weekly. And so, and then I would bring whatever issues are identified by this group, I would bring to our council leadership and our council chair, Randall Brown, and let him determine whether we would add things to the list or not. So we're going to go through all the, you know, the outcomes, the entirety of the outcomes of the session. I'm going to present what we've identified. Now, I welcome anybody else to ask any questions. I'm going to start with our executive directors and leaders. And so to that end, I'm going to ask y'all to introduce yourselves. So if y'all could turn on your videos and just by region. So, you know, if we can start with you, Jamie, if you want to start.
Good morning. I'm Jamie Tyndall, Director at Families Helping Families of Greater Baton Rouge, Region 2.
And I'm Charlie Michel, Executive Director at Bioland Families Helping Families in Region 3.
And I'm Nicole Flores, Executive Director of Families Helping Families of Acadiana in Region 4.
Good morning. I'm Susan Reen, Families Helping Families, Executive Director, Region 5, Southwest Louisiana.
I don't see Jim on, so Chanel.
Good morning. I'm Chanel Jackson in Northwest Louisiana, Families Helping Families, Region 7.
Good morning. I'm Stacy Guidry, Families Helping Families of Northeast Louisiana, Region 8.
Hi, I'm Kathy Dillon, North Shore Families in Region 9.
Is Aisha with us? Or Nicole, you want to introduce yourself? Oh, there's Aisha. Your mic's off, ma'am. There you go.
Having some computer issues. But I'm Aisha Johnson, ED, Region 1, Families Helping Families.
Probably poor connection because you're at the beach.
Great, thank y'all. So Aisha, I didn't, I think your name was something else earlier, so I appreciate you coming on last. So now, thank you, executive directors of our Families and Family Centers. Now I'd like to just go around and all of the LaCAN leaders from across the state, if y'all could introduce yourselves and go in the order of region.
Morning, my name is Julie Falls. I am the LaCAN leader for Region 3.
That means I'm next.
Yes, ma'am.
I'm Melinda Elliott. I'm the LaCAN leader for Region 5, the Lake Charles area.
Hi, I'm Kristen Reed. I'm the LaCAN leader for Region 6, Alexandria Pineville area.
Hi, I'm Mimi Webb. I'm the Region 7 team leader.
And I am Constance Causey, Region 8 for Northeast Louisiana.
Hi, I'm Karen Artis, Region 9, Louisiana.
Nicole.
I'm trying to unmute myself.
Okay.
Hi, I'm Nicole with Regions 1 and 10.
Okay. So thank y'all. And, you know, I really want to thank our leaders and our Friends and Families directors for just maintaining contact with everybody and the council. And over the years, I mean, these, y'all have really done an incredible job with making sure the issues from your communities are brought forward and then helping educate everyone, having meetings with people virtually now. And so what we're going to do is we're opening this up to the public. And so I'm going to welcome any comments from anybody. But what I'll do is I'll just start off by discussing each issue. And of course, the budget's always the biggest thing. And it's not only is it no exception, it's kind of the uncertainty with the revenue projections, you know, when oil prices were like dropped into the negatives and we went into a shutdown and the economy came to a standstill, and you know how much taxes or no taxes were coming in, and it really created and it still has created a lot of uncertainty that you know the legislature and the governor are having to contend with in deciding what to put out there. I will say one huge win of advocacy, of decades of advocacy, I would say, was in the budget bill. There's a main budget bill that's put out every year that has all the agency budgets for the state services. And it contained in there that no, there will not be any decreases in funding for waivers of people with developmental disabilities. I mean, that was pretty remarkable. It was not pretty, it was incredibly remarkable. And then later, you know, thanks to everyone's advocacy, the message got through that, you know, there are other services that are not just in waivers. There's, by Medicaid terms, they're deemed optional, but just because they're not required by the federal government to be put in a state Medicaid plan, but they're not optional to people with developmental disabilities and their families. And so, you know, as the conversation of the budget progressed through the legislature, Governor Edwards and legislators made it clear that all services were going to, you know, for people with developmental disabilities were pretty much going to be protected. Well, that was pretty huge. But with that said, it was you know, the other shift, huge shift related to COVID-19 was the lack of contact and the ability to communicate as quickly and efficiently with all of our policymakers. Usually we'd have yellow shirts. I mean, you know, public testimony. First, you know, the council, one of April Dunn, our chairperson, restaurant. So it was one of her last actions, one of the meetings was to cease in-person activities because people with developmental disabilities have comorbid conditions that make them more susceptible. I mean, sadly, within that same month, April passed away due to COVID complications. And I think that set a tone within our community of the seriousness of this, particularly with people with developmental disabilities. And so one thing I just want to think is that people have continued to advocate and email and contact their legislators, but you know, LaCAN, the council, we did not issue any more yellow shirt days because we were not going to create a position of potentially risking someone's life for advocating. And with that, the legislature also prioritized, and they, you know, instead of having 1,000 or 1,500 bills like they usually would, they really scaled back which bills. And unfortunately, those were some of the bills had issues in them that that everyone here and across the state, people with developmental disabilities really wanted, like requiring cameras in special education classrooms upon request, for example. I mean, that would have had a fiscal note to it, and then, you know, whether we would increase the rates for providers and skilled nursing rates and increase funding for families and family services. And so due to the uncertainty in the budget and the revenue, you know, the council leadership determined that, you know, it was best to not pursue those things to try and make sure we don't lose any rates or services is the priority. And then the other one was to fund and implement Tephra. And we didn't pursue that hard, but you know, we have been in contact with, you know, LDH and others to just make sure that they understand the continued need for everything. And so while Tephra was delayed by 3 months or so, you know, they do intend, LDH indicated it will issue its plan to implement Tephra in September, and then for implementation on January. Now, to be fair, a lot of advocates have expressed they are not necessarily okay with the plan that's being developed. There's actually a meeting today at 1 to 4, and in our council meeting on July 16th, LDH will present from 12:30 to 1:15 on July 16th on this channel on the council's meeting, and receive public input and feedback and the council's official opinion on its plan to implement Tephra. And so I won't go into details of all that now, but the short of it is, you know, while it's been delayed, there's money to at least initiate moving forward with the implementation of Tephra. And Tephra is would allow Medicaid for people with significant disabilities regardless of income. So it's adopted in many states, and it would prevent many families from going bankrupt due to having a child with you know, give that child Medicaid services, basically health care, that would tends to exceed what most insurances, et cetera, cover. And so, and that the council has been behind that for 30 years now, and have had different spots of success, but it's never gotten it implemented. So we're still hoping that this year would be a start to make that. So with those things, let me pull that agenda back up. Do y'all have any questions? You know, and we were spared, I will say, with like the state revenue and the budget. You know, I will credit the administration for figuring out how to get almost $1 billion worth of funding, federal funding from the different CARES bills and such that Congress has passed, and to be able to get those to fill some gaps so that we were not dealing with as big of a crisis in our budget, as big of a shortfall as we thought. So, but there's still I will say there's still uncertainty with the revenue, with what's going to happen with COVID. I do think in Senate Finance, they were taking measures to make sure that agencies were, not giving pay raises, not doing certain things, so that the budget's not constrained later. And it's clear the legislature intends to come back and review kind of where everything is, or at least different parts, different committees, if adjustments need to be made. But are there any questions on any of these issues and these forward-leaning issues that the council has had? Y'all want any discussion?
Sean, there is a comment from YouTube. If you look in the chat.
YouTube, we can thank FMAP. Yeah, so, the comment from Bridget Bergeron, we could take FMAP for the wording in the budget, protect rates to waiver services. And, Medicaid is like almost it's some of the changes is in response to COVID-19, or it cuts both ways. And so the FMAP is the federal share, the state and federal share rate for Medicaid. Medicaid's a huge part of the budget. So, 0.1% of the FMAP is like $10 million or something. It's a huge amount. So, the federal government did a number of things, I would say, to help states and local municipalities to contend with the reductions in revenue. And just to understand that landscape, the federal government can spend more than it brings in, but states cannot. States can only spend how much money they come in. So when the state is looking at how much revenue is projected, it cannot make a budget that exceeds that amount. And so some of the changes to Medicaid is, one is the FMAP rate. I think it's, went from, we were paying 1/3 to now we're only paying 10%. Well, that's huge. That's a whole lot of chunk of money. But the other side of it is, as we're in a state of emergency and we have all these different waivers to Medicaid, there's like exceptions to the typical Medicaid. The state's also required to keep everybody who is on Medicaid as a recipient, regardless if they would have not been eligible anymore. Well, that's a cost, and so there are some, and it's a safeguard to people. I think it's not a bad thing. It's just from a budgetary standpoint, there's a lot of shifts in how the funding goes, and both requirements and flexibilities, or I guess bonuses from the feds that create, to me, even more uncertainty, because it's like, well, when are we going to exit from the state of emergency? And we don't know these things. And so it's, I have a high degree of respect for all the budget analysts who are crunching the numbers to figure out what the possible projections are. But the reality is all those projections are based on different assumptions of when things would happen or not happen. And no one knows any of those things. And so, we have to be prepared for shifts and be prepared to continue to advocate and be part of the conversation if these assumptions are shifted or different, the reality is different than the assumptions that have gone into these projections. So, but thank you for your comment, Ms. Bergeron. Any other comments or questions on those forward-leaning items of the council?
Liz Gary has a question in the Q&A. It is, what is the council's plan for when the FMAP is reduced?
Well, I think as not only the council, but just the entire community, we need to be prepared to ask LDH, what they will, how that will impact, if at all, services. I mean, fortunately, the legislature and the governors made it clear their priorities. And I think they've made that clear actually over the last couple of years in terms of services for people with developmental disabilities, that they do view those services to be necessary and a priority. The problem is, and thank you, Liz, for that question, is, like a couple of percentage points of the share of Medicaid is a lot of money. And so if it goes back from like 10% to 33%, or 32%, it's a huge hit on the amount of state funds that have to be put up. And I think we just have to, all we can do is be part of the conversation. And so when it happens is ask for how or if it's going to impact all the services, and mind you, healthcare services are part of that. And then respond from there. That's, I think, the best we can do, unless you have any other suggestions or ideas. But just keep our eye on that ball and make sure we're part of that conversation. And LDH has been a good partner in terms of, at least letting us know when stuff's hitting. So Liz Gary asked another question. What's going on with LGEs and their funding for Act 378? The CARES Act funding is only through December 2020. The LGEs are the human service authorities and districts across the state that implement, services for people with developmental disabilities, behavioral health, and addictive disorders. So that funding, I've not seen any reduction in their funding. I shouldn't say that. There was a slight hit, but it shouldn't, it wasn't as drastic as the initial hits were. And they still have to put up 9% of whatever their state fund is. There might be some very small percentages, but reductions, but I didn't see any. Most of them indicated it was going to be in staffing, and which is still not good, because if they're not hiring people to, determine people eligible or to process the work that needs to be done, it still slows down everything. But currently, that their budgets have not been hit as hard as initially predicted either. So any other questions? Okay. Then let's just go on to, and I want to share with y'all, I guess, how we keep track of and publicly share our tracking list. So this is the council's main webpage, and on this scroll bar, I think it's the fourth thing here. So you can just choose this, and if you click this, it will share our tracking list. And so this is the special session things, and so I'm just going to use this as the tool to kind of help show like where we are and what the big issues are. And if there's other issues in other bills that are not on this list, feel free, to bring them up. So of course, we always start with I'm going to start with the regular session and go back up to the special session is how I'd like to do this. So you know, in the regular session, the main budget was in House Bill 105. And of course, they went into special session. So that's still an ongoing conversation that they need to finish by tomorrow. But again, we were for that budget. And I also want to thank Representative Zarang, Chairman Zarang of the Appropriations Committee. You know, he participated in our live event that we did, that everybody shared, you know, gratitude for the legislature understanding their issues. So, but you also see, you know, if things are in red, they did not end in the direction of that people were advocating for. And if they were in green, they did. And of course, the budget bill it's still an ongoing issue, but Representative Wrights, you know, offered this the bill on requiring cameras in special ed classrooms upon request. And of course that was pulled due to just prioritization. Here's a big one that was, you know, House Bill 361, which became Act 258 of 2020 by Representative Paula Davis. And that's also referred to as the Dustin Gary Act. So Liz Gary's on. So congratulations, Liz and company. And that will present an option for supported decision-making instead of interdiction. So usually when people turn 18, you know, the only option is either they're on their own or they can be interdicted, which is very restrictive. And supported decision-making is it's perfectly aligned with like what the council's purpose is like trying to ensure that people have the self-direction over their lives, and supported decision-making allows that person to choose a team to help them make those decisions. And so I think that was a huge win. I want to congratulate Liz and Kelly Monroe and some other, you know, people who were behind that made that happen. So any comments on that? Okay, so the next one is House Bill 848, which became Act 1 of 2020, which the first act of a session is typically reserved for you know, a bill of stature and importance. And that, of course, it renames the Act 833 of 2014 session, the April Dunn Act. And April Dunn was, you know, primary reason Act 833 passed in terms of her advocacy and presenting the courage of sharing her story and how, you know, what happened with her in school, not getting a diploma, even though, I mean, she had like 100+ hours in community college. So I think that was a very kind thing, you know, and an appropriate gesture to name that, so that it's now the April Dunn Act is how kids get promoted, and gives a pathway for students, certain students with disabilities, to graduate. I'll skip the green ones. I mean, Senator Foyle also had a bill on requiring the use of video cameras in special ed classrooms. Senator Barrow had a bill that would have established a commission for identifying risk factors for cortical visual impairments. And you know, some of these they just didn't pass. I'll get to the ones that did. So Representative Eccles had a couple of bills that basically increased access for healthcare. He had Act 449, which is Act 1, turned to Act 191, and House Bill 530, which turned to Act 276. And
hey,
so,
Sean,
yes, sir.
I just want to let you know, we had a comment from Cynthia Haig about supported decision-making.
Okay.
She had asked, how does someone enact this? And then there was also a comment from Liz in the Q&A that said, thank you. It was a team effort with the ARC Louisiana, Kelly Monroe, Ashley McReynolds, and myself. So that was dealing with supported decision-making as well.
Yes, so thank you. So the council, there's going to be some training on supported decision-making. I know the ARC has indicated they're committed to doing some, and the council the FY20 planning committee, which the council works on a federal fiscal year. So these activities would start October 1st. They have a recommendation to provide for training on supported decision-making. So there will be upcoming events. Cynthia, I can't see your full name, but it's Cynthia Haying, I'm sorry. There will be some upcoming training events to give people the information and support they need to implement supported decision-making in the future. So that, okay, so then, so Echo's bills, it's a great thing because it really made sure to give people increased access to healthcare, both behavioral health and healthcare services through telemedicine and, you know, like Zoom or connections. Nationally, you know, it was brought up that this still may not give full access, you know, when you consider like when schools are going, because people do not all have access to the internet and computers or privacy. And so there's still some kinks to be worked out with telehealth, but I do applaud Representative Echols and the legislature for increasing access and putting it out there. But I also believe that we have to figure out how to make sure that people who do not have reliable or secure or private internet access or computer systems, that they're not left out of this loop. So there's still a segment that needs to be addressed, but I think this was a huge step and it was done quickly and it gives people access, more access to healthcare. So any questions on that? Okay, I'll go to House Bill 283. I'm trying to find it on here. That's 263 on here. 263, I'm sorry, my eyes were playing tricks on me, which is now Act 121 by Huvall. And this is sort of a little complicated issue, but it's it makes it easier to get the prescriptions that work for people. And so some people don't respond well to generic drugs. Their systems are more sensitive to, you know, how, because it's a generic drug and it has the same amount of drug in it, doesn't mean it gets released at the same level, or there's some other components. I'm not a pharmacist, but that, you know, of how it interplays with the body that does not work for some people. And what the drug pricing tends to do is that they have what's called step therapy or fail first approaches that say you have to like suffer because a generic drug didn't work before they'll give you, let you, your coverage pay for a non-generic option. And what Act 121, House Bill 263 by Representative Huvall did is, for me, it just increased the ways a doctor can either not require the generic drug or get an appeal from using it in certain circumstances. And so it's just increases healthcare outcomes for people with developmental disabilities. Do y'all have any questions on that one? And that passed, so that was good. Okay, and so then Representative Thompson, Francis Thompson, he got House Bill 317 passed, and that's now Act 137. And that establishes, it does two things. There's an option for people with autism to designate that on their license. And it requires some of the training for law enforcement related to people with developmental disabilities to include how to treat and communicate effectively with people with autism. So there's already in law a requirement that was passed, I think 2 years ago. I think Representative James had done that with mostly with the ARC. They put in there more training on people with developmental disabilities. This would require part of that training to be related to autism specifically. And that's Act 137. Any questions or thoughts on that? Okay. So then we have Senate Bill 252. Let me find where'd that one go? By Senator Carter and that turned to Act 223. When people were being received training, driver's education training, this would require that training to contain a component on accessible parking and accessible spaces and aisles, because to make sure people understand to give distance so that those accessible spaces are still accessible for vans to be able to open up their ramps, et cetera. So that was another win. And then Act 466, which I must have jumped this one, was not necessarily about services. This is by Senator Hewitt. It became Act 302, but it's about public meetings. And so the governor, I think it was his proclamation number 30, granted the flexibility of boards and commissions and public bodies to meet virtually through Zoom, through like how we're meeting now. And so what this act does is it just makes that more permanent in states of emergency, so that business can be conducted, boards and commissions and public bodies can meet virtually. We have found this to increase participation and enable more people to participate. There are some snafus and still some concerns about hackers, like in Baton Rouge, both the school board and the Baton Rouge Recreation and Parks Commission were hacked, and somebody came in and started shouting profanities or showing things. I didn't watch it, but it was disrupted the meeting, to say the least. But I think it's maybe those security measures are put in place to address that. This is the future. I mean, there's no reason we all have to travel all over the place to meet. And if it's about accessibility, this is more accessible to a lot of people. With that said, as again, some people don't have stable internet. Now, I saw a comment, the internet keeps breaking up with somebody, and I apologize for that. But it enables communications and conversations to happen. So that's another way to just give people access to join in and share their concerns or their congratulations or their perspectives on issues. So that's another, I guess, win for accessibility. So then there's a couple of, there's the budget bill. There's nothing in the budget that is of concern. And I think, again, we should all be congratulating and thanking the legislators for prioritizing people with developmental disabilities and understanding the need to keep those services intact. Another bill that brought up an interesting issue is House Bill 59 by Representative Mincy. And it's not something the council, people with developmental disabilities in terms of usually advocate for, but it brings up a significant issue related to responsibilities and expectations in ensuring people are safe. Schools or presenting a safe environment for students, particularly students with developmental disabilities. And again, there's research that even at a young age, students with developmental disabilities are more prone to have negative outcomes related to COVID-19. And so there's more reason for concern among our community to make sure that this is considered. And so what House Bill 59 would do is grant immunity to schools if anybody like catches COVID-19 or, and then they amended it to say as long as they were following any rules or statutes. And that's better. When we were against because, we had gotten a whole lot of calls and people who were rightfully concerned. And I think that what I kept hearing was people really want expectations to be clear. And those are not clear. And unfortunately, just say from the school's perspectives, they're not giving, they're giving guidance and suggestions. And I want y'all to understand there's a difference between what is now, how that law states is like, it has to be a rule or a school policy but that means a school board or BESI or the legislature would have to pass a rule and have it vetted and promulgated. And that's a process on practices that would have to happen. And the nature of just our general society being resistant to being told what to do, like the governor extended his phase 2 orders and added, in there a restriction on indoor gatherings of 250 people or more. And did that last week, I believe. And that got pushed back, even though the cases are rising. And that's not a rule. I want to be clear. That's, it's, well, I'm not sure where the governor's proclamations even fall into schools because of how that's worded. They don't indicate like a proclamation or whatever, an executive order, because there's guidance that, and I do credit the department. They pushed out a bunch of guidance. Hold on, let me go find. I must have closed it. They did push this. Department of Education pushed out their 2020 reopening plan. Has a lot of guidance. It's actually really good. It's the issue is it's just that it's not required. And so school systems are put in this position of if there's an outbreak, or first off, there are suggestions. There's nothing required of what they do, whether they check temperatures, how many people they have on the bus and all this. And even those guidelines from discussions I've had with people leads me to question how they can fully open a school if half the kids or more are not on virtual school, how they can even get the kids there, have them eat lunch, move around the school without creating a situation of potential outbreaks. It'd be a challenge to say the least. And they would spend so much time with the logistics is then to get kids to, how much time they're spending on instruction. And, with all these, I guess the lack of clarity or leaving it to individual schools to determine what they would be requiring themselves to do, basically. The schools are still held to the same standards. There's no reductions in instructional minutes. And so like to say to earn a Carnegie credit, you have to give the child so many minutes of instruction. And teacher accountability and attendance, compulsory attendance requirements are all still in place. So, oh, hold on, hold on, hold on, Barbie. Let me see that. Let me see that. Watch your washing hands. Here, your washing hands. Okay. I'm sorry about that. So anyway, I did hear that they're going to have an amendment that will, and that's kind of what seemed to be what everyone was asking for, was for a requirement that will, if you're basing, everybody wants to know what the expectations are for schools. And so I heard there was going to be an amendment to House Bill 59 that would require Bessie to come up with requirements. I also think that will be a very tall and difficult order to pull off because, you know, Bessie's going to want to take his cue from Department of Health. Bessie is not like a medical advisory board, or, you know, they don't have the staff of people with virus, you know, and epidemiology backgrounds to really drive that ship. I'd say, you know, nothing against them. It's just a whole different scope of health emergency. And then you look at enforcement and who would enforce these things. So anyway, I think what House Bill 59 does really great with bringing up is the need for our society to really come up with not guidance, but very clear expectations so that, you know, schools aren't in a position of being sued, and parents and everybody in the community is aware of how things will run. Right now, what's out there is guidance for schools to consider, but it's leaving a lot of school administrators in the position of having to figure out when which things apply to them and what's the best course of action. And you know, there's about 1,400 some schools in the state, and over 200 systems. And that's asking a lot of, I guess, each one of those to figure out. And you can read through CDC and the Department of Health and Department of Education's guidance. And it's like, well, if you get an outbreak, contact your local health administrator and, you know, ask them to figure out what to do. And it's like, it's putting everybody in a predicament. So are there any questions on any of that? Sorry about that. So are there any other questions or comments on any of that? Okay, so the legislature's meeting, you know, right now. House Bill 59 is up to be heard right now in the Senate, and they need to pass the budget bill by tomorrow. And I have a, you know, we'll push out legislative review, LADDC news as soon as all that wraps up. So I appreciate everyone's interest, and thank y'all for coming. And I hope this provide y'all information that y'all desire. Thank you.
How do I leave?